Hey guys, it's your girl Niche. So I wanted to come to you today with a video just on my pregnancy journey and how things are going. So, and I'm sorry if I seem like a little less energetic today, but today I had to get several tubes of blood drawn. I don't know how good you can see that. Just like due to what I feel like could be avoided if they tell you ahead of time, like you're coming in for a prenatal visit. My prenatal visit normally just comes and I go, they take my weight, my blood pressure. They ask me how I've been doing, they write things down or whatever. Fine. So this day I went, not today, maybe a couple of weeks ago, last week I went, and they said, oh, we're going to do a glucose test on you. So I'm thinking, okay, but I did just have Dunkin' Donuts. My sugar is probably through the roof right now. This is at, I think, 1:30 or 2:30 in the afternoon. So I'm letting them know, like, I just had Dunkin' Donuts. And they're like, okay, sure, fine. You still have to take the test. So they give you this liquid. You could pick grape or orange. And this is strictly for pregnant women. So I had the orange. It's a clear liquid. It tastes just like orange soda, I'm guessing. So what happened was I took it. Then they draw your blood an hour after you take it. So after I had drank it, I waited an hour. They drew my blood. Basically, the test came back the next day saying that my sugar is high and I may have diabetes, gestational diabetes. Now, let me just read to you real quick what gestational diabetes is. Hold on. So, gestational diabetes is a form of diabetes that develops during pregnancy and is brought on by hormonal changes as well as genetic and lifestyle factors. Hormones made by the placenta contribute to the insulin resistance in the later trimesters. This happens to all women, but some can produce enough extra insulin to compensate and develop gestational diabetes. Being overweight or obese raises the risk of this condition. Now, I don't know if I told y'all the last video that I am 35 pounds. I gained 35 pounds so far in the pregnancy. You're normally supposed to only gain 25 pounds throughout the whole entire pregnancy. So that was a red flag for them. Now, what happened is, so they think that, this is a possibility now because now they have all this scientific information stating like, oh, well, she gained all this weight, now it's a possibility that she has actual gestational diabetes. Now, gestational diabetes is also supposed to go away after you have your baby. But I do know some moms who still have gestational diabetes and it did not go away. So, or still have, I guess, diabetes now because the baby's born. However, like I said, I'm not a medical doctor. I don't know the correct terms. But so with me, so today I went in and I thought something was, I couldn't eat since 12 a.m. last night or 12 a.m. this morning. I had to be there by 8:30. They drew a tube of blood. Then I had to come back at 9:30. They drew another tube of, oh no, I still had to drink. At 8:30, I had to drink that juice again. Then at 9:30, I came back. They had to take my blood, which was here the first time. Then the first time it was here, the second time it was here. Then I came back at 10:30. They had to take my blood again. So they went here. This one was really sore. Then I had to come back at 11:30. And they drew their final tube of blood. So all this, I couldn't eat until after all that was done. So I hadn't eaten from 12 a.m. this morning, till basically 12 p.m. today. And I am 7 months pregnant. So by the time I got out of there, I was so hungry, I felt like I was about to pass out. And so I had to get something on the way. What do? Get something on the way. Or I had a snack in my book bag because I normally keep that. But I also that didn't really help. So I had to go ahead and get something on the way before I got home. And the thing that I'm just trying to, speak about is that the diabetes and the gestational diabetes is nothing to play with. If you have low sugar, high sugar, or if sometimes you feel like you're about to pass out, that could be indications, early indications of diabetes. So I do encourage everyone, if you are feeling that way, to get your sugar checked, or go, just talk to your physician about it. Because one thing I do know that is real during pregnancy. Now, my main thing is just to make sure I can give you guys as much information as I have, because I'm not a medical doctor. This wasn't told to me at all. So I'm kind of finding out how to, go along and get along. And I just want to pass the information on. But yeah, if you're having any symptoms, dizziness, if you're hungry and you feel like, you're about to pass out, shaking, tremblings, anything like that during pregnancy, or if you're not even pregnant, because those symptoms do come about as well. If you gained a lot of weight during your pregnancy, you might want to let your physician know, or check it, go to your physician and let them know that, basically you want to be tested for that. And diabetes does run in my family, so that was a concern as well. But all right, guys, so I just wanted to come to you with a quick video about my day today. I'm so tired, and like again I do apologize for the low energy, but today they really they really drew a lot of blood out of me, and I wasn't able to eat, so I don't really have as much energy as I normally do. But guys, have a great day, and leave any questions or comments below. Talk to you soon. Bye bye.